Stoppa approach is a midline approach for the treatment of complicated groin and incisional hernias. The approach was modified to expose the lower anterior column and quadrilateral space fractures, plate fractures. It is not useful for fractures patellans with significant anterior displacement. Compared to ilioinguinal approach, it is less invasive. Indications: acetabular fracture, especially medial wall fractures, pelvic ring fractures. Patient is supine. Injured lower limb is draped free with hip and knee slightly flexed to relax iliopsoas muscle and exterior iliac vascular bundle. Foley's urinary catheter is inserted to protect bladder. Involve visualization and monitor urine output. The radiolucent table is used. Surgeon is opposite to the affected limb. Landmark is pubic symphysis and anterior superior spine. Incision is a phalansteal incision, transverse incision 1 to 2 cm above the pubic symphysis. There is no internal nervous plane. Superficial dissection is through the skin, subcutaneous tissue. Rectus abdominis fascia is split vertically in line with its fibers, and the transphalangealis fascia in size just superior to the pubic symphysis. Blind dissection in the radius space is performed. A subperiosteal dissection is performed along the posterior surface of the pelvic brim into the quadrilateral space and posterior column, allowing exposure to the quadrilateral surface and the medial aspect of the posterior column. The external iliac vessels and femoral nerves are protected, placing a retractor under the iliopsoas, and the rectus muscle is retracted to the inner side. The corona mortis connecting obturator and femoral artery is identified and ligated, and continued dissection further along the pelvic rim and quadrilateral space. Structure at risk: obturator nerve and vessel, external iliac vessel, corona mortis, and bladder.